Welcome to Coping with Personality and Behavior Changes, a community dementia education program of Alzheimer's San Diego. My name is Amy Abrams, and I'm the Director of Education at Alzheimer's San Diego. We're a local nonprofit organization headquartered in Kearny Mesa and serving all of San Diego County. Our mission is helping families today while we support efforts and find a cure for tomorrow. Before I get started, I want to acknowledge that this program was modeled on a community education program developed by our colleagues at Alzheimer's Los Angeles, with funds that were provided by the Administration for Community Living, with guidance provided by Dr. Dolores Gallagher Thompson and the Northern California and Northern Nevada chapter of the Alzheimer's Association. So here's what we'll be covering today. We're going to talk about why we see these personality and behavior changes so frequently in people who are living with dementia, what you can do to address the changes, and how to handle your reactions. So you may have noticed in that introduction that this program is going to be focused on you and how you react to the person that you're caring for. So as much as we might want it to be, this is not about how to make someone else do or not do whatever it is that we want them to do or not do. Dementia causes changes to the brain that are out of the person's own control, but we are in a position to control how we respond to those changes. And the first and most important strategy in any kind of a response is simply taking a deep breath, or maybe even 2 or 3, which gives you a little time to think, rather than reacting with the first words or actions that pop into your mind. So go ahead and take a few deep breaths before we get going here. So what is dementia? This is the general term that we use to describe a loss of cognitive function and behavioral abilities that are severe enough that they interfere with a person's daily functions and activities. So some examples of those functions that are affected by dementia are memory, language skills, visual perception, problem solving, focusing and attention, and then, of course, what we're focused on here today is behavior, the ability to control our emotions and changes to our personality. There are many different types and causes of dementia, and the most common of them is Alzheimer's disease.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination, and in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
So, as we saw in the video, as Alzheimer's disease or another form of dementia is spreading into those different regions of the brain, we will see different changes emerge. So a person with Alzheimer's or another type of dementia may see or hear things that are not there. They may get lost. We sometimes refer to that as wandering. They may become combative. They may hit or swat at people. They frequently have sleep disturbances, sleeping more than they used to, or having what we call day-night reversal and having a hard time functioning during the day, being very sleepy, and then being wakeful at night. We frequently see people with dementia refuse to take medication or generally to accept assistance with various types of personal care. It can be hard for a person with dementia to trust other people. We frequently see suspicious or paranoid behavior in people with dementia, and that's due to confusion, difficulty recognizing people, that difficulty with short-term memory. It causes people to frequently misunderstand a set of circumstances. And finally, the repeating of statements or the repeating of questions is a very common symptom that we see in people with dementia. So take a moment and think about the person who's living with dementia or cognitive impairment that you care about, and ask yourself these questions. How has that person's personality changed? What do they say or do that's different now that they would not have said or done before they had this condition? And have you been challenged recently by a new behavior? If so, please keep it in mind as we continue through this lesson. So IDEA. IDEA is a 3-step model that we'll be using to understand personality and behavior changes and to consider some different ways of coping with them than our usual responses, which aren't always helpful. Let's consider for a minute what we mean by behavior. It's the word that we use to describe an out-of-character response to a situation, and it isn't necessarily negative, but of course we're here to talk about those kinds of behaviors that trigger and upset us as care partners and not the pleasant behaviors. Remember that language was one of those functions that I mentioned is often impaired in people who are living with dementia. And the person may need something that they are not able to express. So remember, all behavior has meaning. So we want to ask ourselves, what is the person trying to say? Are they trying to communicate something through this behavior? What does this behavior mean to them? We may have a sense of what it looks like from the outside, But what do we think that this behavior might actually mean to them? Are they feeling sad or angry or fearful, frustrated? Are they physically uncomfortable? Are they in some kind of pain, or do they have sort of the normal day-to-day discomforts of needing to use the restroom or feeling thirsty or hungry? Might they be sick? Is something going on with them medically? Or are they just sort of restless? Are they feeling frustrated, bored? Are they feeling like they're not being heard, not being understood? Lots of possible meanings behind these behaviors that we are describing. As much as it seems otherwise important to remember, behaviors are generally not something that the person is doing just to bug you. They're not being done to annoy you. The person is not doing these things or asking questions repeatedly because they're not listening to you. They're asking because they don't remember having already asked that question. And probably the key, the most important thing to remember is that behaviors are not done on purpose. Right? These are symptoms of a disease in the brain. It's important to note that personality and behavior changes in people who are living with dementia usually happen gradually over time. This loss of function or the emergence of new behaviors does not usually come on suddenly. So when you notice a really sudden change in someone's function or their behavior, some of those symptoms that we have been talking about, there may be an underlying medical cause, such as an illness, an infection, unmanaged pain, and a call to the doctor is in order. So if you see a major change, a dramatic change in the person's memory or their mood, they're more confused or not recognizing familiar people, and again, that's a new symptom and that it comes on very quickly and suddenly. If there's a sudden increase in combative behavior, anger, hitting, yelling, if there's sudden incontinence, the wetting of the bed, not making it to the bathroom in time, or of course, fever or seizure. These are things we want to talk to the doctor about immediately because they aren't the normal expected sort of progression of symptoms that we see in people who are living with dementia. They're probably due to something medical that's going on. But when we're responding to the kind of symptoms that we saw described in the video, using the IDEA model may help. So let's explore these 3 steps: identify the behavior, explore, and adjust in some more detail. So identify the behavior is the first step in IDEA. So how would you describe this behavior? And try to step away and take an objective look at the behavior. You know this person and you know how they normally act or behave. How would somebody else who does not know this person describe what they're doing? Would other people see it the same way? Is it necessarily problematic? This is an important question for us to ask ourselves. Right? If this behavior is just sort of an annoyance, if it's irritating to you, well, then let's get you some support so you can step away and get away from it from time to time. But if this is not something that is harmful, if it is not something that is agitating or bothersome to them, does it necessarily need to be addressed? So think about the behavior in those very concrete terms and describe it clearly. The second step is explore. Explore why you think this behavior may be occurring. Or I guess I should say explore why they think it may be occurring. What does this behavior mean to the person? What might they be trying to say or to do, to accomplish through this behavior, whether it's an emotion that they're expressing or a physical behavior. There is some underlying cause, there's some underlying meaning, take some time and explore what you think that might be. And based on that information that you gather, we need to make some adjustments. And again, the focus is on you. You are the person here in this scenario who needs to make the change. You may be able to influence the behavior if you can figure out what's triggering it, if you can identify some type of physical discomfort, for example, that you can address. You may be able to influence this behavior. You may be able to make an adjustment in the task or the environment. But for the most part, the kinds of adjustments that we're talking about are usually adjustments in ourselves, the way we're communicating and the way that we are responding. So I'm going to show you a couple of brief, but I think very helpful videos that were developed by UCLA's Alzheimer's and Dementia Care Program, which explores some common behavior changes that we see in people who are living with dementia. So as you're watching the first video in each of these segments, please consider these 4 questions. What do you see happening? Remember, how would you objectively describe the behavior? What may be causing it? What do you think that behavior means to them, to the person who's living with dementia in this video? And put yourselves in the shoes of that care partner and ask yourself, how would you respond? Does the way that the care partner responds in this video look familiar to you? To many of us, it will. How might you respond differently? So the first video is on the topic of agitation and anxiety. It depicts a daughter who's trying to help her mom in deciding what to wear. So I've provided the URL on the screen here where a library of caregiver training videos on a whole range of topics is available. There's videos on hallucinations and repetitive questioning, sundowning, wandering, and many more, all available through the UCLA Health website.
My mom's become resistant to my help, and she's now hard to handle. She hasn't been able to manage her basic day-to-day needs without my help, but she believes she doesn't have any problems and doesn't need help. She's easily agitated and gets upset when I try to get her dressed. I'm just frustrated, and I don't know what to do. Mom, where are you? Mom, we're going to be late for your doctor's appointment. Are you seriously planning on wearing that? It's 80 degrees outside, Mom. Okay, look, let's wear this instead. We don't have time, okay? Let's hurry. Mom, oh, God, what is wrong with you?
Leave me alone. I can do it.
No, Mom, let me, God,
Leave
let
me
help you.
alone.
I can help you, Mom.
I don't need your help. God, leave me alone. Get out.
Do this to me.
Agitation and anxiety can manifest as difficulty sitting still, pacing, fidgeting, acting irritable, afraid, nervous, worried, or just being resistive to help from others. The behaviors are often triggered by a feeling of loss of control, misperceiving situations or actions as threats, unmet needs, inability to communicate clearly, and frustration with tasks or interactions with family and caregivers. Changes in a usual routine can also cause agitation and anxiety. People with dementia, for example, may have impaired insight towards their own cognition and ability level due to their disease. For this reason, they have a hard time understanding their limitations about what they can and cannot do. They may not realize that they need help as they do not see themselves as having problems. This can lead to agitation when someone tries to help them. How one approaches a person with dementia makes a difference. If you feel angry, impatient, or frustrated, or if you rush someone or seem irritable, they can sense your mood and react with apprehension, resistance, anxiety, and agitation. Agitation can then escalate to inappropriate behaviors, such as hitting or biting. It is very important to remember that persons with dementia react and respond to how a caregiver approaches them. How you speak to them is key.
Good morning, Mom. How you feeling?
I'm all right.
Okay, what would you like to wear today? You look good in the green or the blue? Which color do you want to try
I
today?
don't need your help. I can do it myself.
Okay. I'm sorry that I made you feel that way, okay? You're doing very, very well, and I'm just here to help in case you need me. I know you can do it yourself very well. I love you so much, and I just want to be here when you need me. Can I stay with you? We can do this together? Okay, good. So we are going to go to the doctor's, and then we can go get some ice cream. How does that sound?
Oh, that sounds good.
Okay, let's get you dressed, Mom. Let's lose this. We want you to be comfortable after all. Let's see. Yeah, I think this is going to look good. Perfect.
Here are a few tips on how to respond to agitation and anxiety. Allow ample time to complete tasks and don't rush your loved one. Use a gentle tone of voice, but do not be condescending. Try to keep your body language positive and use calming gestures and a gentle touch. Don't be demanding or bark orders at your loved one. Instead, provide reassurance. Speak in calming tones and phrases. Let the individual know you're there for support. Try to schedule activities around your loved one's natural routines. For instance, if your loved one is a late riser, plan doctor's appointments for the afternoon. Simplify the environment to reduce frustration or confusion. For example, thin out the closet so that it is easier for your loved one to see inside. Have fewer clothing options to choose from and clothes that are easy to put on.
Another common challenge for many care partners is attempting to help someone who refuses our assistance with personal care tasks. So here is another helpful video on the topic of bathing.
My mother used to shower every day. Now, if I don't remind her, she refuses to bathe at all. If I try to help her, encourage her to take a bath, she argues with me and gets upset, says she's afraid of the water. What can I do? Mom, it's 8 a.m. Time for your shower.
Oh, I don't need it. I don't want one.
Mom, come on, please. We've gone over this over and over.
leave me alone. Don't touch me.
Come on. It's been a week since your last one. You need one. Please, get undressed.
A person with dementia will often refuse, withdraw, or fight during a bath or shower. When you're helping someone to bathe, it's important to be sensitive and tactful and to respect their dignity. Remember, washing is a personal and private activity. Bathing can be scary for patients as dementia progresses.
Okay, Mom, it's noon. It's time for your spa treatment.
Oh, I don't really want to go.
But you love the spa. Makes you feel like a queen. Yeah, and after that, we'll go to your favorite restaurant for lunch.
Well, okay, I guess.
All right, good. Let's go. So first, let's start by unbuttoning your shirt. I'm going to do the top button, and then can you help?
Okay.
Okay. Good job, Mom. Okay, Mom, I'm going to put a little water on your toes. Oh, test it. See if it's okay. How's that feel?
It's warm.
Good. Now let's wash down there. Can you do that by yourself?
Yes.
Great. Okay, we're almost finished. I'm going to turn the water pressure on low and fill up this cup with some water. I'm going to stand up. You just sit right here. Okay? Just lean your head back and pour a little bit of water on you. And we're going to gently massage your hair with your favorite gardenia scented shampoo. How does that feel?
Yeah.
Reassure your loved one that even though bathing is a very personal activity, you're happy to help. Ask how she feels and how she would prefer to do things. Here are some additional tips on how to help your loved one bathe. Be flexible on the time. If your loved one doesn't like to bathe in the morning, try a different time of day. If the word shower or bath causes anxiety, use a different term like spa or get clean. Make the bathroom inviting by using flameless candles, aromatherapy, or soothing music. It's important that your loved one feels safe. Install handrails and use a shower chair. Limit bathing to twice a week and give sponge baths in between. Let her know what you're about to do, one step at a time, and have her help as much as possible. Use a towel to drape over her to provide more privacy. If you don't have one available, consider installing a handheld shower head. Being able to aim the water can be helpful and less stressful.
So those are just two examples of how we can modify the environment and our responses to a situation when we take some time to identify the behavior, being specific in our thoughts and descriptions about the behavior, exploring what it means, right? The underlying cause, what this behavior means to them, what it is that the person is communicating, and then of course, making those adjustments. We are likely to not do this correctly and do it perfectly all the time. It often takes some brainstorming and a couple of tries before we find the right adjustment that helps. So I encourage you to take some time and think about that example that you thought of earlier and the person that you care for, and jot down some notes to yourself. Identify what exactly is this behavior that I'm so challenged by. When does it happen? Where does it tend to happen? Who's usually there when it happens? Or sometimes you might think about who's not there when this particular behavior happens. And again, sort of double check and make sure, is this really a problem, this behavior? So if it is, let's explore it. What do you think may be causing the person to do that? Are they attempting to express some kind of an emotion, some type of physical discomfort, some form of unmet need that they're having difficulty communicating to you or to someone else. And then adjust. What have you tried already that worked or that didn't work, and what else could you try? Is there some change you could make in the environment, the activity and the way you or they are doing the activity, the time of day or the timing of the activity, or things in your own behavior that might help? Finally, it's really important that we acknowledge the challenge of caring for someone who's living with dementia. It's demanding and can outright exhaust you if you're not careful. You need a safety net. So I want you to consider, who would you call for assistance in an emergency? Do you have a backup? Are you getting respite? Meaning, do you have opportunities to take breaks on a regular basis? Do other people in your family, your friends, your neighbors, your community, do they know about this situation? They're probably not in a position to help you if they don't know that you have the need. So please consider what additional support you need. And when you are overwhelmed, take that deep breath. There simply are going to be times that you're overwhelmed. You might need a timeout in order to collect your thoughts and resist that impulse to react quickly with frustration. By taking a deep breath, you're giving yourself a little bit of time to think through idea and those steps, right? Remember, those 3 deep breaths will often give you enough time. So please don't forget that when you need it, Alzheimer's San Diego is here to help. We offer this wide range of free services and supports that are available to anyone whose life is impacted by memory loss or dementia. So we're here to help, right? Please visit our website, where we have a variety of information, resources, tip sheets. Of course, we have a video library on a wide variety of topics. You can get in touch with our social work team Monday through Friday, 8:30 to 5. We're available by phone. We're available by email. You see the address there on the screen. And if you visit our website, you can also contact our staff via live chat. So our team of social workers is there to answer questions, to connect you to resources, to provide you with emotional support. If you're just having a rough day and you need someone to vent, you need someone to help you think through a problem and come up with some new strategies, that's what we're here for. So our office is in the Kearny Mesa Convoy area of San Diego. We have in-person consultations, a lending library, and a variety of in-person programming available. So I thank you for watching. If you have questions about this specific program, or you need any other type of information or support, please get in touch. There's our website, alzsd.org, our phone number, 858-492-4400, and our general email address, info@alzsd.org. So just get in touch and let us know how we can help. Thank you.